Padraic, and I am an environmental consultant with the Florida Department of Health Radon and Indoor Air Program. Today I'd like to talk to you a little bit about radon and its potential health effects. So as I said, I am with the Florida Department of Health, although today we're going to be focusing more on the nation as a whole rather than just Florida. I'm here to speak for Children's Environmental Health Day, and I'd like to extend a special thanks to the Children's Environmental Health Network for allowing me to speak today and providing this platform to reach the audience about a very important topic. Again, this is who I am and this is where I work. But let's move straight into the presentation topics. So we're going to start out with what is radon? Why do we care about it? How does it get into our buildings? And what are the potential health effects that it poses? From there, we'll talk about what can you do. This is testing, mitigation, and we're finally going to end on a little note about radon-resistant new construction. So what is radon? Radon is a noble gas. It's odorless, colorless, tasteless, but it is radioactive. It's naturally occurring. It occurs in the ground as uranium breaks down to radium, radium breaks down to radon, and this comes up from the soil and can enter our homes. It can also be found in earth and construction materials such as concrete. And this radon gas can accumulate in buildings and reach high levels in some cases, and it can become the largest source of everyday radiation exposure for the average American. Now, just a little background. The units of measurement for radon are picocuries per liter. The EPA has set their action level at 4 picocuries per liter. This means that 4 or above, the EPA recommends mitigation. Anything below 4 picocuries per liter, they do not recommend mitigation. So when we look at the average American's annual radiation dosage, if that average American had radon in their home at 4 picocuries per liter, that radon would contribute 63% of their annual radiation dose. If you look at the chart to the right, that's a visual demonstration of that. A big, nasty, red piece of the pie. This is far more than the other forms of radiation, their contributions. This includes cosmic, terrestrial. It also includes medical radiation like CAT scans, nuclear medicine, X-rays, that sort of thing. So it really is important to reduce your radon exposure in order to reduce your overall radiation exposure. And it has been found that promoting and adopting radon-resistant policies in construction can reduce the total annual radiation dose that the public receives by up to 25%. So it's not an insignificant amount. Now, why do we care? The reason that we care is because of the radioactivity. The radon is the leading cause of lung cancer among non-smokers. So if you're not a smoker, that's the most likely reason that you would actually get lung cancer. It accounts for about 21,000 lung cancer deaths per year. If you look at this chart to the right, you'll see that radon accounts for more deaths than drunk driving, drowning, secondhand smoke, home fires. And if you think about the amount of effort that we put into this country to reduce drunk driving, to reduce the number of fatalities associated with drunk driving, I personally feel that it's reasonable to exert a similar amount of effort to reduce the number of radon-induced lung cancer deaths. These radon-induced lung cancer deaths come at a cost to the U.S., both in lives and in monetary value. The U.S. EPA estimates that the radon-induced lung cancer mortality came at a cost of about $6.8 billion per year in the U.S. This is through lost productivity. Now, this chart shows the cancer burden in Florida. I'm speaking to a national audience. I'm sure that your states have similar charts. These numbers hold fairly true to proportions, across the U.S. Lung and bronchus cancers are one of the leading types of cancer. You see it's right there with breast cancer, neck and neck. So it is a very serious concern. In addition to that, lung cancer has a very low survivability compared to some other types of cancers. So it is something that we should be concerned about. Now, why does the radon cause cancer, and why does it only cause cancer in the lungs? Why not outside of the body if it's giving you this radiation? Part of that is related to the type of radiation that it's producing. So I've been talking a lot about decay, uranium decays to radium, radium decays to radon. When a radioactive material decays, it also gives off energy. There are different types of energy that can be given off as radiation. There's a type that's like X-rays, which you're probably familiar with. When you get an X-ray at the dentist, you have to wear a lead vest. That's because that type of radiation can penetrate quite well, and you need thick layers of lead to block it. Alpha particles are different. Alpha particles are the type of particle the type of radiation we're primarily concerned with from radon. It's easily shielded by something as simple as a piece of paper or your dead skin cells. However, the problem comes that radon is a gas, and so when you breathe it into your lungs, you don't have that protection inside your lungs. And so it shoots out these alpha particles, they strike the lung cell, it damages the DNA in that lung cell. And when you damage DNA, there's sort of three things that can happen. The first one is that the DNA repairs itself, and then everything's good. No harm, no foul. Your body goes back to doing what it was doing. The cell might die, and again, that's not a big deal. You lose many, many cells every day. Your body will just replace that cell, and you'll keep going. The problem is when the DNA tries to repair itself, but it doesn't do it correctly. It puts itself back together improperly, and then this can trigger the cell to reproduce and reproduce and reproduce again and again and again until it forms a tumor. And that's where we get our cancerous growth. Now, when we talk about these radon health effects, the risk of this is really based on total radon exposure over a lifetime. The short-term exposure is less important than the long-term exposure. One of the examples we use is that it is far more dangerous to live a year at 4 picocuries per liter than to live a day at 200 picocuries per liter. Despite the much higher levels of that day, living a year in the 4 would actually carry more risk. So how does the radon get into the house? Well, it's a gas, so any small crack, hairline crack you can barely see in the concrete, that's like the Grand Canyon to radon. It slips in through any of these cracks, crevices, through your plumbing penetrations. Here in Florida, we don't have a lot of basements and sumps, but in other parts of the country, sumps can be a major pathway for the radon to enter a home. There is also some concern of radon gas coming from water. It also may come from building materials. As I said earlier, here in Florida, we found elevated radon levels on the 23rd floor of a condominium. Those were obviously not coming from the ground. They were coming from the actual building materials, the concrete of the walls. And it gets into the house. It becomes trapped. It becomes concentrated. Our modern houses, we're building more and more airtight because it's more energy efficient. You don't want to lose air that you've already, spent energy on getting hot or getting cold. You don't want to let that out and let cold or hot air into the home. But when you create a tight house like that, you also sort of trap in your radon gas. And that's not to say that a new house is going to have a worse radon problem than an old house. There's really no way to tell just by looking at the house or whether it's new or old. The only way to tell is really to test. Now, these radon levels do vary. They vary hour to hour, day to day, month to month. Some of the factors that can influence these levels are your HVAC system, your air conditioning system, that's cycling on and off, how the wind is blowing over your house. Any open windows or doors are going to dilute that radon. And just basically any change in the way air moves through or around the building might cause the radon levels to vary. Some of the other factors that can influence radon levels are the underlying geology, as I said before, the construction materials, changes in temperature, any penetrations in your foundation, and also the water table level will make a difference in the radon levels. So any of these things can cause fluctuations. So what can you do? The main thing that you can do is test. The U.S. EPA and the U.S. Surgeon General recommend all homes be tested for radon. Here in Florida, we do offer free test kits through a partnership with the EPA. Other states also offer free test kits. Some states offer discounted test kits. My recommendation would be to contact your state Department of Health or equivalent agency and just see what they have. If your state doesn't offer free or discounted radon test kits, they can also be found in any of the big box home improvement stores. You should be able to find test kits from there. Or you could also go to the Kansas State University Radon website. They do have some test kit offerings through that. There's also the option to use radon testing professionals. These people should be well versed in the proper way to place the tests, the proper way to collect them. Here in Florida, we do certify all our radon testing professionals. Other states do not have a certification program. I would check with your state Department of Health or equivalent and see if radon testers need to be certified. If your state does not require certification testing, I would recommend you do your due diligence and try to investigate the people that you're going to have doing your testing for you thoroughly before you commit. But basically, you test your house, and if you do find a problem, you need to fix it. So just some tips on conducting these short-term tests. They're all going to require you to close your windows and outside doors at least 12 hours before beginning the tests. You can still come and go as you would normally, but they just ask you not leave the windows and doors open. This is so that the radon has a chance to accumulate in the house and you get an accurate reading of what your radon levels would be if your house was shut up. Obviously, you can't leave your windows and doors open all the time throughout the year. I don't think there's any place in the country where the weather would be appropriate for that. So they want to get that closed building condition before you do the test. Also, you don't want to conduct the test in a bathroom, a kitchen, closet, or crawl space. Humidity can affect the testing, so that's why you don't want to put it in your bathroom or your kitchen. There are some different types of tests. There are these charcoal canisters, such as you see to the left side of the screen. There are also electronic types. You see those on the right. There is short-term testing. This is 2 to 90 days. The majority are going to be done in 2 days. It gives a great snapshot picture. As I said, your radon levels might vary over the course of the year, though. So if you do want to get a more accurate long-term measurement, then you can find those types of test kits also. Going with a professional is often a good way to do a long-term test kit, but there are some that you can do it yourself as well. And again, the only way to determine if you have high radon levels is to use one of these test kits. You can't see it, you can't smell it, you can't taste it, so that's the only way that you can know if you have high levels. Now, if you do have a radon problem, you're going to need to fix it. And the EPA's recommendation is that you take action to reduce your home's indoor radon levels if your test results are 4 picocuries or higher. The radon reduction mitigation systems that we have, they're very effective. They can bring your levels down. You know, if you're worried about testing because you're worried you won't be able to get your levels down, this is a very well-established science and it's very effective. We've seen that you can reduce radon levels by as much as 98%. So there are several types of mitigation systems. There's the active soil depressurization. This is probably the most common type. Basically, you're putting a suction underneath the house using an inline fan attached to a PVC pipe. There's also mechanical ventilation, and this involves increasing the air exchange rate, creating positive pressure. And then there's also just simple sealing of cracks, plumbing, electrical penetrations. For either of the two methods, you know, above that, active soil depressurization and mechanical ventilation, I would always recommend sealing cracks and penetrations in conjunction with it. This is just to prevent pathways for the radon to enter. Now you'll see here some examples of the sub-slab depressurization method of mitigation. The way it's generally done is they'll come in and they'll put a hole through the slab or the foundation. They'll dig out underneath that hole and replace the dirt with something that will allow air to pass through more easily, like gravel. Then they attach a PVC pipe, as you see in the image in the center. The pipe is attached. It can be run up into the attic with an inline fan attached in the attic, which will actually put suction on that pipe and put a suction underneath the slab. As you see in the picture to the right, you can also take that pipe directly out the side of the house and then have your inline fan right there on the side of the house, just as long as you get that vent pipe above the roof line where it's being vented. It's probably not as aesthetically pleasing, but it is a valid option. If your home has a crawl space, it is also possible to mitigate. You just have to be very careful about putting down this membrane. As you see in this picture here, this white sheet is a 6 millimeter polyethylene sheet that's been taped to all the sides of that crawl space foundation around the piers that come up. And then again, they're going to put suction below that membrane to remove the radon gas as it comes up. We also have the ventilation method. As you can see here, it involves bringing in your supply air so that you're not creating a negative pressure that's going to pull the radon gas into the house. If possible, you want to pressurize the house so that the radon gas cannot enter. This is something that should be done with, you know, a professional engineer or HVAC system expert. Now, I'd also like to talk a little bit about radon-resistant new construction. If you're looking at building a new home, this is a way to reduce the chances that you will have a radon problem in your home. It's attempting to reduce the radon entry through the foundation by limiting your electrical and plumbing penetrations, sealing up some of the materials underneath the slab. There's always a water vapor barrier put down there. This involves more careful sealing of that water vapor barrier to try to create a gas-tight barrier. In Florida, we do have construction standards for radon-resistant new construction. I would encourage people in other states to look at their own state's building code and see what laws you have related to radon-resistant new construction standards. And this is just showing some of the features of that new construction. Basically, if you look at letter A, that's the gas permeable layer. It goes underneath the slab or foundation. This allows the radon gas to pass easily underneath that foundation to the collection point, as you would see at D. B is going to be plastic sheeting, like I said, a 6 mil or 10 mil polyethylene plastic put down, carefully sealed. Then the slab is poured over the top of that. There is the PVC pipe, the vent pipe that's connected down to the gas permeable layer so that the radon can enter it easily. There are some sealing and caulking requirements. You'd want to reduce the pathways for radon entry as much as possible. And finally, E, up in the attic, you'll put an electrical junction box, and that's just in case after the radon-resistant new construction's been completed and you've moved into your home, if you do a radon test and you see, oh, it's still a little bit higher than I want it to be, it's very easy to put one of those inline fans into the pipe, and you've got your electrical right there to hook into, and then you can turn that passive system into an active system where there's actually pressure being put in the pipe, suction being put in the pipe. So before I finish up today, we are at Children's Environmental Health Day presentation here. I'd like to talk a little bit about children. Here in Florida, we do require testing of private and public schools in all counties that have elevated radon levels. This isn't, universal across the United States. So if your state doesn't have a program like that, it's something that I would encourage. If you are a teacher or an administrator of a school, I would encourage you to bring up radon testing. The children spend a lot of time in these school buildings. Teachers spend a lot of time in the school buildings. It really would be good to know if they're being exposed to high levels of radon. These buildings are also, able to be fixed through mitigation. It's just something we can do to protect our children's health. Another thing I'd like to mention is that there is a national radon poster contest. There is also a national radon video contest. I would encourage any teachers, educators out there to do their own investigation. Look for the national radon poster contest. Here in Florida, we have some high participation rates. The children really like it. It draws them in, it gets them involved. It lets them explore their creative side at the same time, and it educates the public about radon and the dangers of radon exposure. So with that, I will wrap it up here. I would like to say, in summary, radon gas is the second leading cause of lung cancer. High radon levels have been found in all areas of the U.S., and there are different methods available to reduce the health effects from long-term radon exposure, but testing is the only way to determine if you have elevated radon levels. With that said, I would like to thank you. I'd also like to thank the Children's Environmental Health Network for allowing me this opportunity to speak. If anyone would like to contact us to have, with follow-up questions, or if you're interested in, a presentation being given to your organization, please feel free to contact us at 850-245-4288. Or you can email us at the email address listed there on the screen. And with that said, thank you very much, and have a nice day.